There's a silent epidemic happening all around us every single day. And no, it's not some new virus you've been hearing about. It's a health crisis that's been building for years, and it's now the world's #1 killer. So let's get right into it and talk about the global heartbeat and the relentless rise of cardiovascular disease.
Let's start with a number, 19.8 million. It's a huge, almost unimaginable number, right? Just let that sink in for a second. But what does it actually mean? Well, that's the number of people who died from cardiovascular disease in a single year. We're talking nearly 20 million lives gone from heart attacks, strokes, you name it. To put that in perspective, that's more than the entire population of some countries, wiped out in just 365 days. It's just staggering. Okay, so to really understand what we're up against, we have to dig into the numbers a bit more. Let's get to the heart of the problem. So look at this. Cardiovascular diseases, or CVDs, aren't just a leading cause of death. They are the leading cause. We're talking 32%. That's nearly 1/3 of all deaths on the entire planet. Think about that. Nothing else even comes close. And here's the kicker. This problem isn't getting better. Not at all. In fact, it's getting worse. If you look back to 1990, we saw about 12.1 million deaths from CVD. Now, fast forward to 2021, and that number has jumped to 20.5 million. I mean, that's a massive increase. The trend is absolutely going the wrong way. So what are we actually talking about here? Well, the vast majority of these deaths, a whopping 85%, are from heart attacks and strokes. And get this, over 3/4 of them happen in low and middle income countries. They're being hit the hardest. What's truly sobering, though, is how many of these are premature deaths. We're talking about people under 70 whose lives are being cut short. Okay, I know. Hearing all these massive, scary numbers, it's easy to feel a little hopeless. But here's where the story takes a turn. And this is probably the most important thing to remember. This is, for the most part, a preventable epidemic. So how can something so huge be preventable? Well, it's because the main things driving it are things we can actually do something about. We're talking about unhealthy diets, not getting enough exercise, smoking, drinking too much, and managing things like high blood pressure and cholesterol. These aren't things that are just destined to happen. They're what experts call modifiable risk factors, meaning we can modify them. Just let that sink in for a minute. We are not powerless here. A huge chunk of these millions of deaths and all the pain and suffering that comes before them, it can be stopped. It's about changing lifestyles, catching problems early, and getting the right treatment. Okay, but that brings up a really important question, right? With so many things to think about, diet, exercise, blood pressure, all of it, where do you even start? Where do we focus our energy to get the biggest bang for our buck? Well, the answer really lies with the people on the ground, the ones who are there when things go wrong, and maybe more importantly, the ones who can stop things from going wrong in the first place. We're talking about our front line of defense. Big government policies are important, for sure, but the source material makes a really good point. The real day-to-day battle is fought somewhere else. It's happening in clinics and hospitals, between the doctors, nurses, and the patients they see every single day. And that's something we really have to remember. That 20.5 million number, it's not just a statistic on a chart. Each one of those was a person, a real patient. And for every single one, there was a real doctor, a real nurse, trying to make a critical life or death decision. So the question becomes, how do we help them make the right call every single time? The key is something called upskilling. And it really boils down to a simple 3-step process. Step 1, help them spot the risks early on. Step 2, give them what they need to make a quick, accurate diagnosis. And Step 3, make sure they're using the most up-to-date, proven methods to manage the disease. And listen, this isn't a one-and-done thing like reading a textbook in med school. Science moves at lightning speed. Doctors need to be constantly learning about new treatment guidelines, new diagnostic tools, how to handle other related issues like diabetes or obesity, and of course, the very latest in emergency response. Staying current isn't just a nice-to-have. It literally saves lives. Now, when we focus on empowering our healthcare workers like this, it does more than just help one patient at a time. It creates this amazing ripple effect. So let's talk about the path forward. See, the impact works on 2 levels. On one hand, you have the individual impact.
A well-trained doctor saves a single life, and that is an incredible victory. But then there's the systemic impact. When you upskill an entire workforce of doctors, you're not just saving lives one by one, you're making the whole healthcare system stronger. And you can actually see the results. When the workforce is better prepared, you get fewer people coming back to the hospital over and over again, which saves a ton of money and resources. These doctors also become educators in their communities. But the bottom line, the most important thing, is that patient survival rates go up. Period. So what's the end game here? It's all about closing that gap. The gap between what's in the textbook and what actually happens in the real world. It's about taking all that amazing research and making sure it's being used in a busy clinic or a chaotic emergency room where it really counts. It really all boils down to this one simple idea. You can build the most advanced hospitals in the world, but if the doctors inside aren't armed with the latest knowledge and skills, we're still going to lose this fight. The real path forward starts with people, not just buildings. And all of this leaves us with one last big question to think about. The science is there. We know the strategies that work. We literally have the knowledge right now to save millions of lives. So, the only real question left is, do we have the will to actually empower the people on the front lines to use it?